Good afternoon and welcome, everybody. Thank you for joining our weekly COVID-19 briefing. Note, please, that we'll have live captioning and ASL translation available throughout our session today, and a recording of today's session, as usual, will be posted later in the day. Today, we'll be able to go until about 2 p.m. Today's agenda will consist of Chief Health Officer Dr. Preeti Malani giving an update on campus conditions. Provost Collins and Vice President Harmon will provide updates from academic affairs and student life. We're joined today by Dr. Rob Ernst, Chair of the Campus Health Response Committee, who will discuss testing in December and plans for the winter term. And we have some special guests today. Dr. Sandro Cinti is an infectious disease physician and one of the co-leads of Michigan Medicine's Vaccination Safety and Effectiveness Task Force. He'll provide an update on our vaccination planning. He's joined by Stan Kent, Michigan Medicine's Chief Pharmacy Officer, and Dana Habers, Chief Departmental Administrator for our Radiology Department. So thanks to all of you for joining us today. I want to briefly note that a new testing center in Towsley, the Towsley building, will open up on December the 14th for Michigan Medicine staff and be available throughout the holidays. And I'm sure we'll hear more about that during the session. So first, let me turn things over to Dr. Malani for an update on campus conditions. Preeti?
Thank you, Mark. And today I'm really delighted to be joined by two of my favorite people, two of my favorite colleagues, Dr. Rob Ernst and Dr. Sandro Cinti. And so I get to keep my comments pretty brief. So it's December, the semester's wrapping up. Many of our students are home, especially our first-year undergraduates, and others are on campus preparing final projects, studying for exams. And if you walk around campus, it's quiet. In fact, it's eerily quiet. So the number of cases also have been small, not surprisingly. They have come down nicely as the campus has emptied out. And in terms of quarantine and housing, we're down to single digits of each, a total of 17 people as of this morning. You know, our state is sort of doing okay, maybe a little better than they were a week ago. Positivity rate remains very high at 13.8%. It is fortunately much lower in Washtenaw County. And as to the state numbers, it's hard to say. They may be plateauing, or it could be, the numbers could be down partly because there was less testing over the holiday weekend. Hospital capacity remains strained around the state. And so far it's very busy, but it's okay at Michigan Medicine. And that's something that, you know, we're all keeping a very close eye on. Nationally, the numbers are terrible. There were nearly 3,000 deaths a day in the last few days. If you do the math, it's about 2 deaths a minute, and more than 200,000 new cases. So, you know, I say it each week, we just need to be vigilant. We need to be careful. We need to kind of hang on until we have our next steps, and we need to be kind and wear a mask. And I'll just stop there, and we can fill in more with Rob and Sandro.
Thanks very much, Preeti. Next is Provost Collins.
Great, thank you very much, President Schussel. I'm happy to be here again. What I'd like to do is to spend most of my time actually talking about some of the new supports that we are offering to help our instructors prepare for remote and hybrid teaching for the winter 2021 semester. But first, I'd like to publicize some information about a recent change related to campus parking options for our graduate and professional students. So to support research and teaching activities during the pandemic, graduate and professional students are now able to purchase annual, monthly, or daily blue parking permits. The new options became available on December 1st, and that will expire on June 30th, 2021. So we made the change in response to requests from our graduate students to really recognize the unique challenges of this academic year. And in particular, this is intended to assist those students who have special accessibility needs. There's more information about parking and this set of options as well on the ltp.umich.edu website, which is the university website for logistics, transportation, and parking. So I'll turn now to some of the new ways that we're supporting our faculty and our GSIs who will be teaching next semester. First, I'm very pleased to announce that the Teaching with Technology Collaborative will be offering a variety of ready-to-go blue workshops in December and January as instructors are preparing for the next semester. There are dozens of workshops that are being planned. We're using the feedback and the questions that we've been receiving in order to design those and focus them. And you can register at any time going to the Ready to Go Blue website, and I encourage you to do that. ITS is also talking with multiple partners to enhance learning using video conferencing. And one of those partners is Class EDU. We are partnering with them to innovate together and craft a beta product that will build out virtual learning experiences on Zoom. So the basic idea here is that Zoom was really designed primarily for meetings, not for classes. And there are lots of things that we would traditionally do in our in-person classes that either you can't do in Zoom, like have one-on-one conversations in the middle of class with a student, or track different types of participation that students might be engaged in, or change the view from Hollywood squares or speaker formats to be able to highlight both the instructor and also students who might be presenting. And then there are also things that you can do, but they're really awkward to do in Zoom, like playing video or linking to material that might be on the web or on your Canvas site, or doing a quick assessment in the middle of class. So the idea is that this class for Zoom will be intended to make these and a number of other types of activities possible or much easier to do using the Zoom formats. And so addressing a number of the gaps that we have been hearing from our faculty and GSI colleagues as problematic while they're teaching remotely and hybrid. So still in early stages, ITS is looking forward to working with a small group of faculty on an initial class for Zoom pilot to see how to apply it best here at Michigan. It's, I think, exciting, innovative work, and ITS is inviting faculty colleagues who are interested in participating in this to reach out to ITS, the ITS Service Center, or to Ravi Pense over the next few weeks. And so those who might be interested, we encourage you to help us with this project that I think will really provide some important supports for our faculty. I'd also like to announce that a key part of our briefing next Friday will focus on supports for teaching and learning that are intended to be helpful for faculty and GSIs more generally, and we'll announce some more details about that next week. Next, it's really my pleasure to highlight some of the really innovative work that our University of Michigan faculty, students, and staff are engaged in, what I call Michigan pandemic successes. So first of all, the College of Engineering has a skunk works team that does modeling and experiments. They use very conservative assumptions about virus spread, and the goal here is to craft safe ways to continue our activities. They did really excellent work over the summer, identifying a very effective set of changes to make to our university bus system that minimizes the risk for both the driver and for riders. So the School of Music, Theater, and Dance reached out and asked their Skunks Work team, asked engineering faculty to help find ways to really maximize safety of in-person instrument instruction and rehearsals. So the team recorded measurements of practice rooms, modeled airflow, virus particle dispersion, validated those models, and simulated virus with smoke generators, kind of akin to what they did with a bus study. And the results are intended to help inform faculty on how to safely conduct this type of both rehearsal, instruction, and performance. And the preliminary works are really quite promising. They confirm the assumptions, and the safety plan seems very effective. So again, it's a terrific collaboration project between engineering and SMTD that we expect will have broader impact to a variety of different contexts, both within the University of Michigan, but also more broadly. And as I think a great example of ways that we're continuing to learn and adapt during the pandemic. So while we're still not able to produce in-person performances, I want to end by mentioning SMTD's musical theater Ghost Light series that will premiere this evening at 8 p.m. and continue. It's a series that'll continue for the next 2 Fridays, and details are available on their website. In this theater tradition, a ghost light is usually like a single bulb that remains on an empty stage when the theater goes dark. And the idea is to appease the spirits in the theater. So the Department of Musical Theater has created a kind of pandemic ghost light. And these are performances intended to bring our community together, which I think is really important in this time, and also to give our students a platform to voice their current experiences, their struggles, their successes, and their aspirations. So it's a faculty-led, student-driven, fully online review that'll feature songs, skits, dances that are directed, choreographed, performed, and in some cases written by our students. I'm looking forward to enjoying Ghostlight this evening, and I hope many of you will as well. And more generally, please find ways to take care of yourselves as we move into the often very stressful final weeks of the semester. Thank you.
Thanks very much, Susan. It sounds like it's in the true tradition of the show must go on. I turn things over to Vice President Harmon.
Thank you, President Schlissel. Today, I'm going to touch on 3 updates. One, I'm going to share a brief update on winter 2021 housing. 2, I'll explore some exciting programs and resources offered by Student Life as we head into the final season and the end of the semester. And 3, I will highlight some recent student and staff efforts and achievements. So with housing, although we encourage students to remain at their permanent residence for the winter term, we did make housing available for students who need to live on campus based on one or more of defined criteria that was need-based. During the winter term, we plan to house approximately 1,800 undergraduate students. And this is in addition to the graduate students who will remain on campus, which will be approximately 1,700. The 1,800 undergrad number is just a small portion of the capacity, which is near 10,000. All undergraduate students will reside in single occupancy rooms, and students who have applied and were accepted for a space in winter term have been notified that they will have a space. Additional information such as their building location will be sent with the housing contracts this weekend. We will also continue to house again over 1,700 graduate students. Additional information can be found on the housing website by going to housing.umich.edu. Next, I'll talk about some programs and resources for the final stretch. This week, I want to highlight 2 specific areas in student life that have programs for students to take advantage of even today. Our first year experience program and the Center for Campus Involvement. First year experience, I'm excited to share that this program will relaunch the Community Matters cohort program for winter semester. Many students have found this program helpful throughout the fall term. The program will resume on February 1st, which gives students a chance to join a cohort on community building skills and provide an opportunity for students to make meaningful connections. Students, I encourage you to sign up now, but you have until January 21st to do so. You can sign up by doing a search under first year experience and Community Matters cohort in your browser. You don't have to wait until next semester to take advantage of FYE programs. FYE also has planned a series of programs open to all students to wrap up the end of fall semester. These programs prioritize on wellness, time management, taking care of the maids and youth, and even virtual study tables. The Center for Campus Involvement has programs for students wanting to take a break from studying and meet some new friends. Make sure you study though. And you can sign up even tonight for a program called UMix tonight. The theme is Meet Someone Numix. Wherever in the world you are, you can participate in this program. Just fill out an interest questionnaire, which you can find on the events page at events.umich.edu, and you'll be matched with other students with similar interests to you. Then tonight at 9 p.m., you'll hop on a Zoom call and you'll be assigned to a breakout room with your group. Even if you don't sign up in time, you can still join in and you'll be put in a random group to chat and get to know each other, followed by a Zoom Pictionary tournament. And yes, there are prizes, Amazon gift cards for the winners. Next, I want to mention kudos and special recognition for a few different groups. I want to take a moment to thank all of our students for your commitment to making the transition home and off campus as smooth and safe as possible. Thank you for complying with exit testing, isolation before and after travel, and for really demonstrating a strong commitment to the Wolverine culture of care. I want to congratulate the University of Michigan debate program. Our debate team recently won the 64th annual Franklin R. Shirley Classic hosted by Wake Forest University. For those of you who may not know, this is a big deal. The Shirley Classic is widely considered the national championship of the fall semester. Students Giorgio Rubini and Rafael Pieri reigned victorious with a 13-0 overall record during this tournament. That's amazing. I also want to recognize Aaron Call, Student Life's Director of Debate, for his work with the team. Additionally, there have been countless individuals contributing to the community vitality through their own, on their own, through student organizations and classes. In closing, I want to mention that this has not been an easy semester for all of us, but there are still things to celebrate and victories that are big and small. As we head into the home stretch, I hope each and every one in our community will take a moment to reflect on their own victories during fall 2020. Thank you very much.
Thanks, Martino. Next, Dr. Rob Ernst.
Thank you, President Schlissel. It's been a couple of weeks since I've been on the town hall. It's been an active November, so a few things that I wanted to talk about before we hear about some of the exciting preparations for COVID vaccination is to give a little recap of the November activity, some of the testing that was done, as Dr. Harmon had just mentioned, as part of the exit testing strategy, and then some of the planning that we have for the winter semester and the testing that's associated with that. As we entered November, we were coming out of a stay-in-place order that really was quite effective at bringing down the rate of new cases, particularly on campus and residence halls. And even despite the fact that community activity was accelerating quite a bit through the month of November, we were happy to see that student cases remained relatively flat. And that was a sort of a pattern that we had seen as from our case investigation partners, is that there hadn't been really much connection between campus activity and the surrounding community activity. Back in September, there was a time when student cases from the University of Michigan accounted for almost 70% of all cases in the county of in Washtenaw County, but towards the end of November, we're only accounting for about 7%. So that represented a major shift. As we approach the end of the in-person instruction period, we set a strong expectation for students to be really careful if they were going to be traveling back to their personal residence. So the combination of exit testing as well as isolation and being really careful with travel was a heavy emphasis of education. We dedicated a lot of resources to provide access to testing for students in the latter part of the month. And I also want to appreciate faculty and staff who put on pause some of their understandable, interest in getting tested so that we could really focus on students during that time. That was really, really helpful. In the 10 days leading up to the end of the in-person instruction, we did almost 13,000 tests on students. It was about 2 to 1 off-campus students versus students on campus. We were prepared to see an impact on our quarantine and isolation space during that time. And we were really concerned that that might impact the travel plans for many of the students. Fortunately, the positivity rate for students as part of their exit testing was less than 0.7%. So we really were able to move a lot of students off campus, I think, safely. We have had very little occupancy in our quarantine and isolation space. There were a couple dozen students here over the holidays, and I want to appreciate the Dean of Students team and the housing teams for accommodating and those students during that time over the holidays. The testing program will continue during this period between Thanksgiving and the December holidays, and it's going to be a shift now to try and accommodate more faculty and staff who are interacting with the campus and our colleagues at Michigan Medicine. We will have the ability to do up to 4,000 tests per week as part of the sampling program, and we encourage everybody to register for that program. I think folks who have been through it have found it to be very efficient. It takes less than just a couple of minutes to verify your affiliation and to go through quick instruction and provide the saliva specimens. So we're feeling good about this resource going into the winter semester for providing the capacity to support the campus. The testing center will be open until December 18th and then take a break until January 4th. And that's when it will open again for the winter semester. As has been reported out, there will be, in addition to mandatory weekly testing for students in university housing, we'll also have mandatory testing for all students in the winter semester who will be coming to campus for instruction. This is undergraduate students for instruction or use of facilities. And there's going to be a lot of activity between now and then to come up with ways to document compliance with that. And it's going to be a lot of work working with our IT folks and some of our folks in housing and some of the other areas. So that's going to be the attention for our COVID response team. We remain prepared to respond to cases, and with this uncertainty about how many students are still remaining in the Ann Arbor area and surrounding campus areas, we are prepared to do case investigation, contact tracing, and support folks in quarantine and isolation space. You know, fortunately, we were off to kind of a slow start this week. We were prepared for perhaps a surge and haven't seen it, fortunately, which has been really great. And so still, our quarantine and isolation occupancy is Dr. Milani mentioned a moment ago, is really, really very light right now. Besides the preparation for the weekly testing and the assurance of compliance with those mandates, we are also prepared to do the pre-arrival testing program as we had done with a partner, Quest Labs, for the fall semester. We're again going to go through a very similar kind of workflow for students who will be coming into university housing. We'll package that with an expectation that students be mailed a test kit to wherever they happen to be leading up to the fall semester, and then observe a period of enhanced social distancing to make that a very worthwhile test. If you do the math on starting, that period of enhanced social distancing comes right after the beginning of January. So think about it as your New Year's resolution to keep a renewed effort to wear your mask and keep your spacing from other folks. As we'll hear about in a moment, I think there's also a lot of exciting developments with vaccines, and the campus health response team is going to be connected to that work, which will be led out by my friend and colleague, Dr. Sinti, and I'm excited to hear, how that's progressing, and I'm very excited to be participating in that. So I'll conclude my comments with that.
Bob, can I ask you to add just one thing that fits with what you've been saying? You know, the CDC released some new guidelines on quarantine. And I'm sure, although our quarantine facilities are relatively sparse right now, when the new semester starts, it'll certainly affect us, and it affects folks at home even. Are we changing or still contemplating our guidelines in light of this new CDC guidance?
Sure. Yeah, I just had a meeting with our partners at Washtenaw County Health Department this morning about that. And as has been mentioned throughout the course of the semester, our university public health teams have been working in really close partnership with the county health department throughout the entire course of the pandemic. I think it's been really important. So we will be making sure our interpretation of that advice from the CDC is consistent. The guidance is important to kind of look at. It still says 14 days of monitoring for symptoms is the ideal situation for people who have been identified as close contacts of having been infected with COVID. If somebody is able to be monitored daily for symptoms and has remained asymptomatic for 10 days, it may be possible to limit their quarantine. The best advice is to say, if you've been identified as a close contact, you're going to have to take the advice of your case investigator. The CDC is very clear about the fact that there may be high-risk areas where this a shift in practice might not make sense. So, if students are the residents of residence halls or other areas, that may be a situation where we may not want to reduce the period of quarantine. And this is for folks who are identified as close contacts, not folks who actually have COVID, is the other sort of a caveat to that. I will add, though, that we continue to make enhancements with our contact with folks who are in quarantine and isolation. Pretty excited that starting next week, we hope to do a soft launch of a text-based interactive platform for students who have tested positive for COVID and are in isolation, to kind of keep track daily with them about the development of symptoms. So that's I've been sort of acting like a test isolation case all week. And so I've been getting these daily pings asking me how I'm feeling. So it's sort of a nice service that is easy. It comes as a text. And if there were a concern, we could links directly to our health service and our medical teams to provide intervention.
Good. Thanks very much, Rob. Let's move on, and I'll introduce Dr. Sinti to discuss his and his team's work preparing for COVID vaccination.
Thank you. How are you feeling, Rob? Okay, good. My name's Sandro Sinti, and I'm going to update you on a big effort over at the university where we've developed a vaccine, a COVID vaccine and therapeutics task force. I would like to also introduce Dana Habers and Stan Kent, who have both been my co-chairs. And it's not our main aim, but one of our aims is eventually to be able to meet in person, as all of you want to also. So I have a slide set here that we can go through to explain what we're doing. And then I think there are some questions, and yeah. So this is the vaccine, the COVID vaccine and therapeutics task force. Let's go to the next slide. We met for the first time about a month ago now. It's on November 2nd to try and develop this group. We were asked by Jeff Desmond to get together and have now developed this big project. And so what you're seeing here is the work, not of 3 people, but of probably hundreds when we look at it. But there are these main groups that are involved. If we go to the next slide, you'll see that the university team was recently added, including Rob Ernst, Amy Cohn, who many of you know. And it'll become very clear in a moment why that team needed to be involved and added. And we are working on making that connection a lot more tight also. Let's go to the next slide. These are the subject matter experts throughout the university, and we're tapping everybody we can. And as you probably are aware, the university and many hospitals are all really tapped out in terms of staff and effort. So it's been really great working with folks because they're putting in extra time to do this. It is good news though, and I would keep saying that. It's hard work. We get tired every day. I'm sleeping well these days, but it's necessary and it's good news. Let's move forward to the next slide. These are the 2 vaccines that are going to come out. Pfizer vaccine will probably come out. There'll probably the EUA, or the emergency use authorization, will probably be asked for by Pfizer next week. And we are expecting to get vaccine as early as the 15th of December. So we are working towards starting our phase 1A, which I'll talk about on December 15th. Moderna is the other vaccine provider that is going to come out probably a week after that. And you can see from here, the vaccines are very effective. When you're talking about effectiveness, they were willing to go down to 50% to get these approved, and these are well above that. So that's good news. And even if you've seen Anthony Fauci, he has been very positive about these vaccines. You do have to get 2 doses. It's not easy to do. There's a cold chain that I won't talk about here, but these have to be frozen at very cold temperatures. We will be, the Pfizer vaccine, again, will be coming out first. These are both our vaccines called mRNA vaccines. It's a new vaccine platform. And so what we're really interested in is the safety data that's going to come out in the next 2 weeks. The preliminary data has been very good about safety for both of these also. Next slide, please. These are the phases and the prioritization. So whenever we have vaccine, we have to prioritize because we know we're not going to get enough vaccine to vaccinate everybody right away. So the CDC is helping us with this. And phase 1A is going to be healthcare personnel And that's anybody within the healthcare system that has a that is front-facing with patients or has exposure to potentially contaminated products. So that would also be people who are working to clean the rooms. That would be people who are doing other tasks around patients. The other group is going to be long-term care facilities and residents for obvious reasons. There have been many outbreaks in this state and other states in long-term care facilities. 1B is essential workers. And this is why we added the university, is because very quickly, you guys happen to be educators and you will be part of the essential workers in our community. And so getting educators back to work, which includes K through 12, which includes the college campuses, is going to be very important. And as it is in the healthcare personnel, it will be involving and vaccinating everybody around the educators who help the education mission overall at Michigan. So we realize this, and we are partnering with the university in order to vaccinate you folks also. The next group will be our high-risk folks and people who are over the age of 65. That's group phase 1C, and then we go into the larger and larger populations. Let's go to the next slide, and you can see a little bit of a timeline here. Oh, I'm sorry, before that, I'm sorry, can we go back? Next slide, please. In phase 1, what we expect is we're going to start with our employees, which is about 30,000 employees, but there are also folks around the university in pharmacy, kinesiology, nursing, medicine, social work who need to be vaccinated because they're exposed to patients. So we will be vaccinating those folks too. There will be limited doses, and so we will have to prioritize within that group. So the first doses will go to our older employees over the age of 65, then people with high-risk conditions, and then the following group will be opened up to the greater population of healthcare personnel. Let's go to the next slide. Here's the timeline, and you can see these phases. You don't go from phase 1 to phase 2 to phase 3, or phase 1 to phase 1A, phase 1B, phase 1C. We're eliding into these phases, and so we will start on the 15th probably of December in our phase 1. We will ramp up as we get more vaccine, and we're looking to start vaccinating people on the Hill in the hospital, and then we will also have off-site clinics in ambulatory care. Very quickly, we will move into phase 1B, which includes the university. And so we've started discussions, and Rob and I Dr. Ernst and I have spoken. Amy Cohen has been in our group. Andy Birchfield has been on our group. And so we are starting to figure out how we're going to move into the university. Where are we going to do this? How are we going to get staff to do this? And those are huge issues, but I think we'll figure this out, and for the reason of getting people vaccinated. Let's move to the next slide. 1B, again, essential workers. That's educators, people, food and agriculture workers, utility workers, police and fire. So it won't only be us vaccinating, it'll be public health will be vaccinating other people within the community. We want to be very aware that we have a responsibility to people in the community also. And so we have patients who are parts of these groups and will need to vaccinate. So our education, our campaign and communications campaign will be very active once we say this is a good vaccine, we'll move forward and we'll have to communicate well. So University of Michigan campus is part of that. And we estimate that first phase 1A plus 1B will be about 60 to 80,000 people. So that's a lot. And that's 2 vaccines. So double that in terms of vaccines we have to give. Okay. Next slide. So the thing we're working on now is developing a vaccine operations center. It may not be called that. We're still working on the details and the name, but it will be a coordination center where we will identify vaccinator workforce, coordinate training of vaccinators, coordinate scheduling. This is a huge task, and we realized, Stan, myself, and Dana, that early on that in order to be able to do this right, we needed somebody to be able to manage this operation. And so we're looking for the leadership, and the leadership will both be an operations person from the University of Michigan, and probably somebody from campus too. So this is very preliminary, but we need to ramp this up fairly quickly given the previous slides that you saw about how the phases will go up. Let's go to the next slide. We're working with all these groups, and there are actually some that we didn't put on here, but we're working with the public health. We're working with Washtenaw County Health. We're St. Joe's IHA. We'll be in communications with the VA, although they will have their own process. And we're also working with the university, of course, the University of Michigan. Let's go. I will update quickly on therapeutics in the next slide, because our committee also takes care of that. There are two new medications that are out that are called monoclonal antibodies, and these are given to people in the outpatient setting. They have to be given IV. The person has to be observed for an hour after getting an hour's worth of infusion. So we have a team, Tejo Gandhi, Lindsay Petty, and Jared Nagel, who are working to make this happen. And right now we are giving these infusions at the West Ann Arbor Health Center. And if you look at the next slide, this is the priority groups. So we're giving it to the people who are most likely to get sick. And the idea is to give these medications very early to drop the viral load down. It's a therapeutic. They have worked well in studies to bring down viral load and to keep people out of the hospital. And that's really what we need to do, because our hospitals, as you heard, are full. Our emergency rooms are full. Our ICUs are full. So I think that's my last slide. I will stop there and open it up for questions.
Thank you very much, Sandro. Hang on one moment. We'll do questions in a little bit of an organized fashion. And if it's okay, I'll turn things over to Preeti to help moderate the questions. We've received some in advance and we're getting a whole bunch in real time. So Preeti, can I hand it off to you?
Yeah, absolutely. And Sandro, thank you. It actually warms my heart to really see this. And we've been at this in infectious disease really for months now, and that we're actually moving to the next phase. Sandro, you mentioned the issue of safety, and I think this is something that's on people's minds.
Yeah.
Our work that came out last week from the National Poll on Healthy Aging asked 50 to 80-year-olds about vaccines, and most of them are very interested in getting vaccinated, but more than half also said they worry about the safety of a rapidly developed vaccine. And these results obviously they underscore that need for really transparency and talking about how vaccines work. And so that's what I really want to ask you about. Can you talk about what we know and what we don't know? And of course, we're all waiting to hear more next week, the FDA and that discussion. But can you talk about any anticipated complications?
Yeah, absolutely. So there is some data on safety. They unrandomized 8,000 people in the Pfizer study. And what they found is there were really very few severe adverse events. And those severe adverse events that were more than 2% included fatigue, severe fatigue, and muscle aches. There are some people getting fevers, and that's a concern for us, not because they're going to be very sick, but because they might look like they have COVID. So if we give our healthcare workers, say we immunize a whole unit, and then 3 of those people end up with fevers, that could really affect the unit. So we're having to look at that possibility and make those kind of changes. Overall, though, and in the phase 1 and phase 2 studies of these mRNA vaccines, they were very safe. And so everything we're seeing in the beginning shows us that they're safe. There's data that's coming out, as you said, Preeti. It'll be 2 months after the second dose in about 43,000 people for the Pfizer trial and probably 30,000 people for the Moderna trial. So we're going to have a lot of data there. So the FDA and their advisory groups, which Arnold Monto, who many of you know is on, will have to cull through that. And so will the ACIP, the Advisory Committee on Immunization Practices. But upfront, it looks like these are pretty safe. I know we've polled our group too at the hospital. It looks to be about 2/3 that would actually take this vaccine. I think the situation around the country has really changed people's minds on this, but I think we have to communicate very effectively what we feel is the benefit and the safety of these vaccines.
Yeah, thank you. And I agree. And, again, as we're getting closer to an actual vaccine, it's a little easier to ask people about that. And the fact that the efficacy is so high, I think helps people with that decision. And, frankly, Sandra, as soon as you tell me it's my turn. I
Okay.
personally will be, I don't fall into the 65 group.
You do not.
I don't.
Otherwise,
But,
I would.
yeah, but I'll be there. And to me, part of the calculus is I'm also very concerned about the risk of COVID. That is a known risk. And there are some unknowns with this, but I agree with you that the huge numbers, it really helps reassure me. It's something that I would take and I would recommend to others.
Yeah.
One other question around vaccines, and this one, sort of pivots to students. What is the university's plans for getting students vaccinated when available and making sure as many people as possible are vaccinated, really when we start thinking about the fall semester?
Right. And so there are some unknowns there. So first of all, the students would probably be in they might even be phase 2, right? Because unless they have risk factors, then they might fall into the phase 1C. And we really have to see how quickly vaccine is ramping up, because what we know now is that the number of vaccines that were promised went down a little bit from Pfizer because of being able to develop the product. They don't have all the resources. They're starting to get those. So as long as we have enough vaccine, we can vaccinate a lot of people if we organize this thing well, and we can start. And as I said, we're looking to vaccinate through several months and into the spring about 80,000 people, maybe. I can't put that number down I can't put that down as a set number, but that would mean 2 vaccines. So you're talking about 160,000 vaccinations, but it can be done. If you have, vaccinators can vaccinate pretty quickly. We'll be safe about it. So I think we'll get there. Will we get there before the fall semester, Preeti? I can't tell you that. I don't know.
Yep.
But maybe we'll have the teachers protected. We can't rip off our masks right away. We have to wait, but teachers may feel better about teaching. I don't know yet.
Yeah, lots of unknowns, but I have to say I'm hopeful. And of course, Pfizer was not quite in that Operation Warp Speed, making the vaccines at risk. And Moderna is actually going to have, in theory, more stock. And again, that EUA should be coming shortly afterward. So I'm going to pivot actually to the others and talk a little bit about what campus might look like once vaccine is rolled out, basically once we're sort of past this pandemic status. So will the university continue to offer students more choices on how they will take classes in the future? Will we remain primarily a residential university? Do you see a need for staff to have a physical presence on site in the post-pandemic era? And I'll throw that question to the president, the provost, as well as Vice President Harmon, if any of you would like to take on some aspect of that.
I think we'll have learned things about remote education that will help us enhance the delivery of education and perhaps even broaden the number of students we can provide education to. But I think the synergy between the kind of things you can do in person, in the classroom and outside the classroom is what makes the college experience, quite special. So I don't think in-person higher education is going away. I think it'll change and become better and more flexible because of what we've learned during the pandemic.
And I would just add to that exactly that there is so much that we're learning that will enable us to teach and learn kind of more effectively and in more creative ways. There were already starting to be a number of programs at the university that provided both either more remote options for students. And I suspect that there will be more of that, but it's hard to predict exactly how much more. In terms of staff, there's quite a bit of work going on as we speak. In particular, we stood up a committee that has the acronym WISE, which stands for the Workplace Innovation and Staff Experience Committee. And it's really focusing on trying to think through what makes sense for us to do post-pandemic in terms of all that we've learned about work that can be done remotely. So how do we do that in more thoughtful, creative ways? So it's really too early to answer all of those questions definitively, but it's quite exciting, actually, the opportunities I think that are being presented to us. And so stay tuned.
I would just add briefly, although we've clearly uncovered some innovative practices and sometimes more people participate in virtual activities, but we also know from our students, the survey that was conducted, that they value in-person connections. They are not as motivated with strictly a virtual experience. So I think as Dr. Schlissel said, the foundation, we need to have that human interaction.
I agree, and I look forward to the post-pandemic era, and actually look forward to maybe seeing all of you guys in real life. Martino, I don't think I've seen you since you arrived in Ann Arbor. I met you last year. So, just a question to the president. This is a related question that came up from the audience, was just around requirements. Where are you in terms of your thoughts on will your university require the vaccine?
Yeah, I think at first there's no plan to require the vaccine. It's something that might be considered in the fullness of time, but it's going to be a situation where the vaccine is limiting in dose. And if I've got people that want to take it, that are in risk groups, that are frontline healthcare providers, that are faculty dealing with students, people that have actual risk, I'm going to give it to them. And rather than force people who might be scared or unwilling. And I think confidence in the vaccine will grow. I'd roll up my sleeve right now, because the 40 or 50,000 people that have taken it and have been followed for long enough that, compared to my risk as a 62-year-old of dropping dead in the next year, the vaccine is safe. So otherwise healthy. And I can tell you from my own medical background, without a doubt, vaccination is the #1 most effective intervention medicine has ever developed. It prevents disease. There are examples of it eliminating disease. The amount of human suffering that's been mitigated through vaccination is unimaginable. We spend gazillions of dollars on percentage improvements in the outcome of dreadful diseases that people already have. The beauty of vaccination is it prevents you from getting sick and likely prevents you from spreading the illness to others. I also think it's an absolutely remarkable advertisement for the world's investment in science. To be able to go from the first description of a disease to an efficacious vaccine in less than 12 months, and then to be able to ramp it up and theoretically deliver it to hundreds of millions and then billions of people, we take it for granted, but it's truly, truly breathtaking. And if this thing had hit us 50 years ago, or even less than that, we would be wearing masks and distancing for a long time, and we'd be losing lots of loved ones because it's hard for people to stick with these public health interventions. So we should really take a moment to really behold what's happened. And the only reason I wouldn't roll up my sleeve is I'm not qualified to get the first round of vaccine. I'm not 65 yet, and my white coat is hanging in a closet. I'm not seeing patients. So I don't want to cut in line, but as soon as it's my turn, I'm happy to do it.
I'll be right there with you. And just the time to sequence the virus to the first in-human test vaccine was 60 days. Moderna was doing those phase 1 trials. So it is really a remarkable feat. Dana, we're lucky to have you. So you and Stan, so thank you. And I just have a question for you about tracking the vaccine. I mean, not just like giving all the vaccine, but like what's going to happen around tracking and really getting those 2 doses?
Yeah, thank you. So we do have in our state actually a pretty phenomenal registry. So that exists already, and we'll leverage that existing infrastructure. Some of the requirements for being a recipient of the vaccine include having the IT infrastructure, the communications in place to be able to document. So when a vaccine is given in our system, within 24 hours, that information will flow through to the state's vaccine registry. And there are several communication tools being developed. Some are smartphone based, others are coming through the EHR, the portal. Some are actually just, you'll be handed a physical piece of paper with your return date on it to get that second dose. So we'll have a lot of redundant systems in place to try to ensure communication thereafter.
Thanks. And I know our friend and colleague, Mark Fendrick, who I know Rob and Sandro know well. He is working actually with HHS on this topic. And I know I've sort of tried to connect all the dots this week with And I've talked to him about this idea of incentives. And I think, it'd be nice if we end up as a workplace being one of the places that tests some of these things, because it's, we got to make it convenient. We got to make it easy. We have to think about things like parking, logistics. So pretty exciting. So now I'm going to pivot away from vaccines, as much as I love vaccines, and talk about class. And this question is for the provost. And this came from one of the students. There are students, myself included, who cannot get into classes for winter semester that they must take to stay on track to graduate on time, even though these classes are online and have a capacity of 800 students. How are you going to support students like myself?
Great, thank you. And again, that's another important question. So I want to start out by saying it's difficult to give specific advice without knowing an individual student's context. So the first thing that I would strongly encourage is to reach out to both the general advisor that you have individually, but also the advisors within your department and program. Those advisors are really the ones who would be best able to provide support as students are navigating general requirements and program requirements as they try to make academic progress. I also wanted to highlight that even classes that are often offered remotely do have enrollment caps in many cases. And so of course, those are not caps that are coming because of the physical room capacity, but we do want to make sure that the faculty and the GSIs we have available for the course will be able to give the kind of attention to the students who are in the class to be able to offer the material and to move forward, in the ways that really enhance learning. And so it's certainly often the case that there's some flexibility when we're online in terms of what those caps are, but they're not unlimited. At the same time, strongly encourage people to sign up for the wait lists. It's very frequently true that as registration continues, students make different choices, and people on the wait list do get into those classes. So the two main things are, please work closely with the advisors who can help you make sure you're making progress towards your degree. And if there's a class that is full right now, please do add yourself to the wait list, because there's at least a good chance in many cases that you'll have an opportunity to get into the class.
Thank you. So this question is a very practical question. The university extended certain M cards that expired this year until January 5th, 2021 due to COVID and the card centers being closed. How can those with expiring cards properly support the state of Michigan's pause of non-essential trips to any college campus? And I'm going to ask the president to weigh in on this.
Yeah, thanks, Preeti. I think what the question is asking is, how do you get your M card extended or keep it active without coming to class coming to campus when we're trying to keep the campus low density? And that's a good question. There have already been multiple extensions of M cards that are about to expire. Our IT staff, along with the office that handles M cards, is proactively reaching out to people whose cards are due to expire and orchestrating extensions of these cards. In terms of their capacity for building access, that's all dealt with computationally. So you don't need anything magic done to your card. It could happen on the IT side. It doesn't need to happen on your card. And then the website of the M-Card site has an FAQ and lots of information. So it's a known problem. We're not going to have people lose their access to buildings they need to be in. And we're not going to force you to travel to campus against the guidance and best advice of our state leaders. So good question. We're countering it in a number of different ways. So it's important and we know about it.
Thanks. So there's another question for Provost Collins. Can non-faculty who work in learning support join the Class EDU endeavor?
Absolutely. So if there are instructional staff who are interested in helping to pilot what I think is going to be a really valuable tool for instruction going forward, please do contact ITS as well. We would certainly value your engagement.
Thank you. And while we still have Sandra, I'm going to pitch this question to him. I've heard the vaccine makes people sick. Do folks who get it need to quarantine after they get the vaccine?
No, so the issue with, so can it make people say, it causes arm pain, so people will have pain in their arms. It's a few people, as I said, about maybe 2 to 3% can get fatigue. Some people can get muscle aches, and a few can get fevers. And so the most of the people who get those symptoms will probably have to quarantine if they're healthcare workers, because they may have the same symptoms as they do for COVID. But generally, no, you would not have to quarantine, or there's nothing you wouldn't have to stay away from family members or anything like that. It's not a live vaccine, so we're not giving. It's not a vaccine that is actually the virus, so it doesn't transmit to anybody else.
One more question related to vaccine is the effectiveness period. Someone wanted to know about that. Do we know anything yet, Sandro, about how long the vaccines might be effective?
We don't, because the most we've had is about 2 months in large groups, 2 months out. So in these studies, they'll look at antibodies, they'll look at, of course, clinical picture and if people develop COVID, but that's going to be a while before we know how long they last and whether they last one season or we have to have a different vaccine every season. So more to come.
And one final, sort of related question: if someone's already had diagnosis of COVID documented, should they still get the vaccine?
That's a really good question, and the answer to that is not completely clear, because we don't know how long you're protected after having had natural disease, and some people don't register on a serology test either, the antibody test that we get. So we don't have that guidance yet from the Advisory Committee on Immunization Practices. Now, what you could say, and if we have limited vaccine, we might say people who actually had it and had it documented on either a PCR or on a serology may not need to get it up front. But I think we would still be offering it to people who had had disease in the past.
Yep.
It wouldn't be harmful.
Important, and lots to learn. And I we're all looking, we have that date on our calendar. I have to say, when the New York Times alert came up the other day from Britain's EUA, it was a moment for me. I mean, truly, it was extraordinary. I'm going to turn it back over to President Schlissel to give us his final thoughts and wrap us up.
Yeah, I certainly want to thank everyone who participated in the call today, and Dr. Sinti and his colleagues. You'll be hearing much more about the vaccine in the weeks ahead. Please realize that we're working on this in real time. We're relying on guidance as it comes out. We actually haven't even seen the data yet behind the vaccine. Many of us want to look at the actual data. This is an extremely important intervention that'll help the university get back to normal. Questions like, will we have to keep wearing masks once people start getting vaccinated? It's going to take a while to vaccinate a significant fraction of the University of Michigan population. Dr. Sinti mentioned, 60 or 70,000 people. It sounds like a lot, but actually there are many more people than that come and go from the campus and our surroundings. So, until we get up to a very high percentage, we're still going to have to take precautions. And we're learning things all the time. So we have to be open to the fact that we're making the best decisions we can, but there's still uncertainty involved. That's just the way it is. It's not anybody's fault. It's the fact that it's a novel disease, it's a dangerous disease, and we're trying to keep everybody as safe as we can. So we'll be providing much more information about this as we learn more, and we'll keep the community involved, and we'll ask everyone's thoughts and best ideas for how we move forward during this transition between not having a way to prevent the disease beyond wearing a mask and then having everybody vaccinated. It's my hope that we can get back to some type of semester next fall that resembles a normal University of Michigan semester. I think that's a good and fair ambition to have. It's not a certainty, but I think it's possible enough that with a good organization, a good supply of vaccine, and everyone's enthusiastic cooperation and working together, I think we really can get ourselves back to a greater degree of normal. So thanks very much. Have a great week ahead, and we'll see you next Friday. And thanks everybody for your help.